Mode.
Good
Unmuted.
afternoon, everyone. Welcome to the Community Health Training Institute webinar. We're really happy to have you here. We're going to give folks another minute to sign on before we jump into today's topic, so hang tight, grab some water, grab a quick stretch before we jump into today's exciting topic. Thank you. Again, hello everyone. I'll get started. My name is Daisy Ortega. I serve as the director of the Community Health Training Institute. Thank you all so much for joining us this afternoon. This webinar is being provided to you at no cost thanks to generous funds from the Massachusetts Department of Public Health. And today our topic is communication tips and tools to strengthen your impact. I'm going to toss it over to our wonderful presenters, Karen Shoneman and Tamaki West, to get us started in today's topic. I just want to go over some logistics before we jump into the content. In your screen, you see the number. You can text, so you can be automatically added to our email list. Feel free to do that. Also, if you are on Twitter, use our hashtag, which is there as well. If you have not participated in a webinar before, please look out for the questions box. If you have any questions throughout the presentation or at the end, you want to type it there. And a survey will also pop up at the very end of the webinar, and we would appreciate your feedback on today's webinar. And then we'll also follow up with the recording of the webinar and some additional resources for you all a couple of days after today's presentation. Again, there goes our hashtag, and you can follow us at HRA Institute on Twitter. There goes the questions box there. If you're not familiar, you can look for it now. And then again, this is the topic for today, and our wonderful presenters, I'm going to turn it on over to them so they can get us started.
Thank you. Thank you, Daisy. Welcome, welcome. Thank you for joining us today. My name is Tamaki West, and my colleague,
I'm Karen Shoneman.
And we are from Health Resources in Action, Boston-based public health organization that have been providing consultancy for New England and beyond for the past over 50 years. We'll talk about communication planning today and to strengthen the impact for your effort. And we'll provide a lot of tools and tips. Just going to go quickly over today's objectives. Describe the value of developing communication plan for your efforts. List the key elements of a communication plan. And to explain how to create the plan, including goals, objectives, audience, channels, and measuring success. So what we're going to talk about today, why communication planning? And we're going to walk through communication planning model that we use. With the worksheet, which is very practical, they include steps to develop your plan.
And the model and the worksheet are both things that can be applied really to any kind of communication effort. We're going to be trying to keep this broad yet applicable to all of you, no matter what your communication goals might be.
And we'll give you a lot of examples, including the real communication campaigns and efforts that we have worked on, tools and tips, again, very practical throughout the webinar today. So based on the registration data, we have lots of folks today from all over the country. Many of them are from Massachusetts, same as us. Some folks are from Arizona, North Carolina, South Carolina, Texas, Oregon, Maine, Alaska, and many more. Many of you work for nonprofit organizations, some of them local health department, hospital, healthcare system, community health center, coalitions. Many of them are program managers, coordinators. Some of you are community health workers, community engagement managers. We also have scientists, IT architect, grant writer, HR manager as well. So what purpose do you all communicate? The number one purpose was to engage stakeholders in the community. We also have support behavior change, which we will give you a lot of examples today. For organization visibility, for advocacy effort, and also educate community with through events, information, and resources, and also recruit new members of the coalition.
So those are a lot of different purposes, and we're very pleased to have all of you on this call, and we're going to do our best to share some examples that might be relevant to you, but again, we'll say this over and over again. The model and the tool that we'll be walking you through and then following up with can be used for all kinds of communication purposes.
And we will encouraging you all to ask any questions throughout the webinar. We'll try our best to respond to your questions.
All right, so even though we have a very nice sense of who you all are, and it's a very diverse set of people, there's still a little bit more that we would like to learn from you. So our first question is, are there clear communication roles and responsibilities in your own job description? We will give you a moment or two to answer that question. Okay, we got a lot of answers here. Okay, yes we do. Many people, thank you everyone for participating. We got a large majority of responses from you. Next, I want to take a step back for a minute, and then we're going to ask you a follow-up question. So stepping back, what is communication really? At its core, communication is the exchange of information, of news, ideas, even feelings. And there are lots of different ways in which we can convey these things. It might be words, it could be sounds, it might be behaviors or body language, it could be other kinds of signs. We create and share meaning in all of these kinds of ways. So our follow-up question, based on that definition, in order for you to do your job and to do it effectively, do you communicate on a regular basis?
All right. So we close. All right. Okay. So we got some responses here.
Yes. It's looking pretty consistent. And actually, we are pleasantly surprised to see this. I think that what we're seeing is that 93% of you said that, yes, your job role formally defines communication as one of your roles or responsibilities, and about the same percentage said that you do communication work on a regular basis. I mean, frankly, we all do it pretty much on a daily basis, and I'm pleased to see that because I think there is greater and greater recognition for the role of communication, understanding the role that it plays, and that it is integral to our work. And so for a little comic relief here, there is indeed a communication aspect to everything that we do. Even when we don't acknowledge it, we are doing it all the time. In order to accomplish anything at all, there needs to be an effective exchange of information and shared meaning. That is what communication is at its core. And the question is, and the reason that we're all here today, is that communication can be done on a more effective or less effective basis, and we're going to try and help you do it in a more effective way.
Okay, so as the poll result shows, many of you, almost all of you, already understand the communication, what the communication is, and you do it every day. So everybody does communication, but with some planning, you can make communication more effective. So just going to go through some benefits why we are doing communication planning. So the audience hear a consistent message over time and multiple times through multiple channels when you actually use the communication planning. So they will remember the message throughout. And when you use the communication planning, that would make sure all efforts are strategic and all the efforts should support your goal and objectives. And all efforts work together, are complementary, and are not duplicative, so they're all coordinated. And then also with the clear goals and objectives, as well as well-planned activities, you can actually measure progress and then make some adjustment midway in order to demonstrate success. So what that means, these are all to increase impact, meaning how effective you are in bringing about desired change and for the goals that you have. And efficiency, when we say efficiency, it's about money and time in the most focused way possible. So we are going to share models and tools throughout this, through this webinar that can support relatively in-depth and robust, and it's almost our golden approach for the communication planning.
Yes, our gold standard. Yes.
But we do recognize everybody have different needs, capacity, resources within your organization or coalitions. So, and then it's all based on, complexity of effort and, scale and, again, the resources. So we will provide basically the meal size, like dinner size approach. But the communication planning doesn't have to be that complicated or like a big effort. It could be snack size or bite size. Even small bite-size approach for the communication planning is useful. Okay. So,
all right. So I want to just reiterate what Tamaki said. Communication planning can sometimes be really quick and dirty. Sometimes it can be a significant investment of time and effort. And it can be anywhere in between. So keep that in mind as we're talking throughout this webinar. This is meant to be a very simple and sort of visual approach that demonstrates how we generally do our work here at HRIA. It's sort of the high-level approach. We'll take you through it, and also we'll take you through the very clear sort of step-by-step tool that will be you'll be getting a glimpse of during this webinar, and we will also share with you. This is all to result in the final product of a communication plan. And we will share with you in the end what that might look like for you as well. So just a broad overview here first. First, step one, you really need to start with a thorough understanding of either the public health problem that you might be trying to tackle or some other kind of challenge that you might be facing or needing to take on. Understanding what the causes are, who is most impacted, and really where there are opportunities for communication-based solutions is key. Next, you need to make sure that you understand your target audience. You need to gain insight into their lived experience, who might influence them, and what kind of change might really be achievable within and for your target audience. Next, armed with all of that kind of information and insight, we do what we call create a promise. And this might be a new concept to some of you, but it is also very common sense. The promise is really the most important benefit that your audience is going to experience by engaging in whatever behavior you are asking them to engage in. And ultimately, that behavior has to outweigh any other costs that your audience might have to expend. That could be time, that could be money, it could be other kinds of efforts, and also barriers that they might have to overcome. You need to consider all of those things in creating some kind of promise that you can make to your audience. Next, you really need to make sure your audience is engaged, and we saw from a lot of responses from participants that this is often where you all really face a challenge. You need to get people's attention, and ideally, if there's a way you can, you want to give them a chance to really sort of reap the rewards of the kind of behavior, whatever you're asking of them. Also, throughout and also at the conclusion of a campaign, evaluative findings can guide you through some mid-course corrections. You can make improvements, and ultimately anything you learn might help to shape future efforts as well. Certain kinds of evaluation can also get into how you might be able to demonstrate success and how you brought about positive outcomes and impact. One thing I want to emphasize is that although it looks nice and clean and linear, this is really not a linear process. You can do your best to approach it in this way, but you're often going to need to be thinking about multiple steps all at once. Sometimes what you learn in step 3 might help to inform your thinking in step 2, for example. So it really is an iterative process, and that's okay, and the whole point is that you're learning along the way and making improvements to your plan and your overall approach.
Yeah, that's a good point, Karen. So we, many times we go into, for example, step 4, trying to engage the audience, and then realize that, oh, we need a little bit more insight about this audience in order to reach in XYZ. So we go back to step 2 and then come back to step 4. So you could go back and forth sometimes.
Yes, you absolutely can, and you should never feel bad about doing that either. If you've learned something, that's great. Apply it. So what we want to do is take you through this 5-step planning process, and we're going to do that with the help of a communication planning worksheet that we have developed. You will get this as a follow-up to the webinar. This worksheet includes nearly all the thinking that needs to go into a communication plan, ultimately. And like I've said, you can apply this thinking to any sort of communication effort. As we take you through this process, we encourage you to think about a particular goal or challenge that you are facing right now, or that you want to take on, or that in achieving is going to really help you further your work and your overall mission. And apply this thinking to that particular goal or challenge. Along the way, we're going to be asking you to make your contributions to this webinar, and we also want to respond to your questions.
And then again, throughout this whole kind of walking you through, if you have any question, if you like us to pause and explain a little bit more, feel free to send us some questions using that box.
Absolutely. All right, so we're going to jump right in. This first step. Now, in order to be able to articulate a goal, in order to really know what you're working towards, you first need to have a solid understanding of the problem or the challenge that you are facing. And these are some of the kinds of questions that we consider and we suggest that you consider in that process. What are the causes of the particular challenge, or what's contributing to your challenge? This might be social or societal things. It could be social norms. There may be institutional or policy-related kinds of things that are contributing to a particular challenge or behavior. There are obviously environmental reasons as well, whether that is physical environment, for example, or even the communication and marketing and advertising environment in which we all live. So considering how the environment contributes to or can actually alleviate a problem is very important. You know, for example, neighborhood conditions and social norms might make walking and biking difficult, or those things can actually facilitate engaging in those kinds of healthy behaviors. So environment is key, and we'll talk a little bit more about how communication and environmental approaches might work together as well. In understanding the problem, you really need to know who's most affected. As an example, and this is some work that we do here and I work on a regular basis, children in particular urban and low socioeconomic areas might experience more severe asthma than others in different kinds of geographic areas or different socioeconomic kinds of groups. So that kind of thing is very useful, understanding prevalence, how many people are affected, and then just how deeply they are affected, what that severity might look like. Another thing to really know and learn from is what kinds of solutions have been tried in the past and what have we learned. And that might even be, what have other local groups tried in the past to tackle a particular problem or challenge? And what kinds of things can we learn from public health practice, or sometimes even other industries that public health might compete with at times? How can communication strategies contribute to a solution as well? I talked about some environmental kinds of factors that might really determine how someone makes decisions and engages in healthy behaviors. Communication strategies alone are not going to be able to change the environment, but those things can work together to really heighten the impact of an overall effort. So understanding your problem, it can be an informal process, it can be a quick and dirty kind of process, or you can do more robust research and develop something like a problem statement, which can be very useful if you're working with a larger group as well. And everyone really needs to understand and get on board and share in that understanding of what the problem even looks like in the first place. So understanding your problem then brings you to the point where you can really define a clear goal. And as we've been saying, this is an iterative process, so sometimes goals and objectives even can change and get adjusted over time. So on this slide are a couple examples of work that Tamaki and I have done in the past. In one case, the goal was to increase the age that young people were starting to have sexual intercourse, and we wanted them to also be using contraception more effectively, ultimately in the interest of reducing teen pregnancy. Another was to enact community water fluoridation so that the oral health status of the overall community could be improved. So the question is, what's the problem that you're trying to solve, or the way in which you're trying to have a positive impact? This might be to our examples here, it might be to increase healthy behavior, or it might be to influence an effective coalition or community health planning process. It might be to bring about the adoption of a policy. So there are many different ways that you might define a goal. And the last thing I'll say about goal is that this is often long-term. It can take months. It can even take years in some cases to achieve a goal. So goals that's sort of the lofty thing that you're working toward. And for those of us working in the public health world, we might be measuring progress on a goal through what we call long-term outcomes. So next we're going to make you think a little bit, and we would really, really appreciate your contributions here. What is a problem that you're trying to solve, or a way in which you are trying to have a positive impact? And we would love, if anyone is able to jump right in, we'd love for you to share with us what a goal might look like for you in the work you do. Share it in the questions box, and we'd love to feed some of those back to you and to learn a little bit more about what you might be trying to do. We'll give you a moment to think, and we'll move on.
And it depends on the sort of your answers we get. We'll try our best, if we can, to use your goal as an example as well. So that would be your opportunity.
Yes. So we're seeing one person here, I believe, has a really good sense of what kind of goal she, and I'm going to guess, coalition that she's working with is working towards, the misuse of prescription drugs. That's a big one. Getting people to eat better. Despite lots of confusing nutrition information. So you've just named some of the barriers and challenges right there. Improve the quality of life for cancer survivors. Reduce the prevalence of distracted driving. So these are all, I'd say that these have all been mostly defined as goals. These are the big picture, lofty, sometimes long-term things that we are working towards. Increasing HPV vaccination rates, absolutely, that's so important in this day and age. So again, we're seeing a really wide variety of work you all are doing, missions you have, and this is really exciting to see, as a matter of fact. One thing that I'm working on right now, as an example, is to increase walking and biking to school in order to increase physical activity and academic performance. And some of you might know that as Safe Routes to School. All right, last couple. Combating obesity, now that's a big one. I'd say that's almost a vision. That's a huge one. Maybe you can get a little more specific with a goal around, the reduction of childhood obesity, for example, through healthy eating and active living. But these are all really great. It's wonderful to see the different kinds of work and the very important work you all are doing around the country. So moving on, you have to start with some sense of your goal, certainly, but the next thing you need to do is absolutely gain a clear understanding of your audience and their lived experience.
Yeah, so we can't stress enough that the importance of knowing your audience. We oftentimes compare our work with some commercial marketing, and in the commercial marketing, through marketing and communication, they will guide you to what they want to do, what you want to do. So trying to sell you something from one thing to another. What we're trying to do is not necessarily for something that you're thinking about every day or something that you want to do, but this is for your health or community's health. So it's a little bit of different, but both equally, you need to know the audience. So with the goals that you all mentioned earlier, you want to think about among what group do you want to see change, and then also stay realistic about it. And the more you define, the more effective and efficient you can be to reach your goal. And another one is oftentimes really missed. Who are their influencers? So if you want to see the change amongst young children, who are their influencers? Parents, moms, dads.
And conversely, if you want moms and dads to particularly buy certain products, the food industry, just as an example, knows that actually reaching children, and they are key influencers of their parents' buying behavior. So it's really wise for us to take a lesson from time to time from the commercial industry as well, in terms of knowing who the influences are of buying behaviors, of health behaviors, and all kinds of other decision making that happens on a regular basis.
Absolutely, absolutely. And in terms of community, you can think about other influencers within the community, who they listen to. It could be faith leaders, it could be, the school nurses, it could be school superintendent, coaches, for men over 50 for health decision. It could be their partners or wives, and it could be talking to them about their health over dinner, whatever, but they're influencers. And also stay realistic and then think about what kind of change is achievable among this audience.
Yeah, sometimes we have to take our audiences through some increments, if you will, to get them maybe to a point where ultimately as public health professionals we want them to be. And sometimes we as public health professionals have to step back, recognize what kind of change really is going to be possible, and work toward that instead of a lofty goal that we know we might not be able to achieve, and it might be an uphill battle along the way.
And I'm just gonna, this is an example, when we, for community water fluoridation effort that we've done, we were trying to recruit members for the task force. And in order to recruit them, we need to get to their boss and then their boss. So they're influencers, kind of like trying to think around them, what's the environment that where they make decisions. So through the communication planning worksheet that Karen mentioned earlier, we have primary audience and secondary audience. And again, primary audience is the audience among audience, which audience that you want to see the change. There's a group, your main group, and their influencers. Karen, do you want to talk about the example for the teen pregnancy prevention in terms of this? Or?
Yes, certainly. So we're going to weave in one particular example that we worked on here at HRIA a few years ago. So in that particular case, we'll talk more about it. You'll see some visual examples from it. Our primary audience was essentially teenage girls, pretty much young teenage girls, ages 13 to 15, who were, by nature of where they lived and some other factors, disproportionately impacted by teen pregnancy. And although we struggled a little bit, I think we all felt a little resistant to falling back on targeting the teen girls. We really thought long and hard about it, and we felt like that's where we were going to be able to make the biggest change. But on the other hand, we also acknowledged that the the teen boys with which, and sometimes the older men, unfortunately, with which they interacted were also influencers. So we looked at those teenage boys as a secondary audience of that particular campaign.
And for the community water fluoridation campaign, this is for the Brockton we worked on. So this is essentially policy change effort. And primary audience was the policymakers. It could be city council or water operator or boards of health. And the secondary audience, which is their influencers, are the opinion leaders and other stakeholders in the community who the decision makers and policymakers listen to. So that's what kind of like the work that we did. So there is the plan to get to know your target audience. We do have, again, the tool research planning worksheet, which will be available after the webinar as a follow-up. And again, this is sort of the process we go through. But we want to introduce this process, and then you can customize to your need, and you can make it, again, bite-size or the whole dinner.
Yes, you can scale it as you need to scale it, and we'll give you a few tips about how you might be able to scale it back and approach it in a fairly simple way if that's what you need.
And then through these research activities, this will inform your communication effort. And you can conduct this research in the early stage, which is we call it explanatory research, to get to know about the audience, just a general knowledge about the issues that you're tackling or where they're at and what they care about. So that's the qualitative research. You can also do quantitative research through surveys. It could be free. And you can also do secondary research. It could be literature review, environmental scan, something that's already existing. So just to give you some ideas of what are the methods you can use, again, literature review, it doesn't have to be hours and hours. It could be just a few hours you can spend. A lot of great, useful resources out there and articles. Environmental scan, it could be done online. A lot of information is accessed online. It could be what kind of efforts, campaign, have been done, and to learn basically the best practice existing. Focus groups. It could be really short. It could be you can borrow some time from existing meetings or some gathering, or you can plan 90-minute discussion group that with the facilitated by the moderator.
Something that we have done with I think relative success now and then in our work is approach focus groups slightly differently, and instead of getting 8 or 10 people around a table, we've gotten much smaller groups. We call them triads. So you get 3 like-minded in some ways people around the table, and you really can engage in a very intimate conversation with a group that's small. And it also feels much more achievable sometimes than trying to schedule something where you're getting 10 people around a table and getting everyone to commit to that. So I encourage you to think about how you might be able to sort of tweak some of these ideas to work for you, and that small triad approach can be really useful too.
And again, that decision could be made based on resources you have, the time you have,
the time your audience has.
Exactly right. Focus group could be really, it sounds really formal, so some folks might want to call it information gathering, discussion group, so it could be, like customizing in any way. And we would recommend using the combination of different methods here. It could be just a couple of them. Oftentimes, one small kind of prep methods, for example, environmental scan, can inform you for what kind of question you want to ask to your audience.
Absolutely.
And research objectives. that's something that you have to have. Need to be clear, objective, and what you need to learn.
Yeah, I would say no matter how formally, informally resourced, well-resourced or minimally resourced your formative approach might be, those objectives are really important because they're going to guide you in whatever sort of approach you take. They will, help you ask yourself, what do you need to know about your audience? What do you feel like you know but you need more insight into? Where are you completely lacking insight into your audience? You might have no sense of what they think, how they feel, and why they make decisions that they do. These are the decisions that we make on a daily basis, and often we don't necessarily know or understand why. Um, and you also really need to think about what kinds of information are you gathering, are you wanting to gather that you can actually act on. So I just urge you to, think about the kinds of questions that you ask of your audience. Make sure that you can sort of deliver on anything that they might talk about. Don't overpromise, and make sure that you're always getting at communication-related strategies. So what can you achieve through communication, and therefore what kinds of questions do you want to ask of your audience, and what do you want to learn from them to inform your communication strategies?
So among the challenges that we heard from all of you through registration, one of the big themes that we saw was about engaging audience, reaching audience. And this is what you have to do in order to be able to engage the audience. So spend a little bit of time to get to know about the audience. So here we are. So bite-sized solutions. We're going to try to use this to kind of like offering throughout the webinar to kind of give you bite-size for formative research plan. So you can do really quick and dirty way by going to some existing relevant meetings. It could be PTA meetings, or it could be community meetings that are already existing. If you're trying to reach your audience, it could be just go to youth groups when they meet after school and just borrow their time, half hour. But you have to bring the questions to ask based on objectives you have. Use the free tools, SurveyMonkey. A lot of you might already know or use SurveyMonkey already. But again, this should be based on your clear objectives.
And while SurveyMonkey is great for quantitative research, you can of course do some qualitative research as well. You can't get real deep, but you can certainly get qualitative responses to questions. And so SurveyMonkey can be used for all kinds of purposes. And it can be particularly useful when you're trying to get response to something visual, and you maybe want to get a wide response or just ensure that you're giving many people the opportunity to weigh in. And sometimes the easiest way to go about that can be through an online survey that is free, for one thing, and that can give you a very clear and automated report. It doesn't require you to do a lot in the way of analysis.
And then remember, like once people engage in the discussion group, a lot of people do want to help you and as a follow-up. So just feel free to, like follow up with them and then ask follow-up questions. And as I mentioned earlier, combination of different methods are helpful. For the environmental scan, you can work with graduate students in your area to do just 10-hour, it could be less than that, 10-hour environmental scan that could be conducted online.
We do this frequently. We have, we're lucky enough to be in the Boston area and have a lot of public health programs at our fingertips. It's not to say that other students and other graduate programs or even undergraduate programs couldn't help you do something like this. We pay a fair hourly rate, and you can get some amazing results in working with graduate students, as long as, just like Tamaki keeps saying over and over again, as long as their research and their work is guided by your research objectives.
And the research is something that, so just full disclosure, I'm not a research person, but we do this because sometimes some information that you think that the audience need, and through the research, your idea get validated and give you more confidence in what you're doing. And sometimes you get aha moment. This is when we feel really, really happy and pleased to be able to do the research. The aha moment can guide you through successful communication plan and successful, just a success later on.
Absolutely. And AHA suggests that it's something that you had never thought about or that just hadn't come, to complete clarity before. And we've all had those moments in some of the communication work that we've done. All right, so moving on, you now, we assume, have a clear understanding of your problem. You're armed with great insight that you have gained through formative research. So now you're ready to define or maybe make adjustments to some communication objectives that hopefully you've already been thinking about, but you really do learn a lot through the formative research process about what you can really accomplish and where your opportunities are. So like we've been saying, this is an iterative process throughout the way. So these are objectives that I need to really reinforce here. These are objectives that can be achieved through communication efforts. We are often integrating them with other strategies. We're doing a lot of that work here at HRIA, and I believe that you all are as well. So communication strategies ideally are being integrated with programmatic strategies, policy, systems or environmental kinds of strategies to really get that maximum impact that we all in public health and related fields are hoping for. These need to be measurable. I won't get into the whole SMART objective thing, although it's a really good principle to understand what SMART objectives are. But just for the purposes of this discussion, I am going to emphasize that objectives need to be measurable in some way. And we define two kinds of objectives in our work. Those are bulleted out here in front of you. There are awareness, knowledge, and attitudinal kinds of changes that we aim for in our work. This is what people will know or feel or believe as a result of our communication efforts. And the other is behavioral change. This is the behavior, the desired behavior that we want people to engage in. In some cases, this might be a particular healthy behavior or health behavior, and in some cases, it's another kind of ask or call to action. And so I wanted to share a couple examples with you, bringing our teen pregnancy prevention effort throughout this webinar. For us, an awareness or attitudinal change that we were aiming for was the belief that teens, young teenage girls in particular, can have the kind of romantic relationship that they want without needing to engage in risky sexual behavior. And to also believe that healthy relationships are desirable and that those are the norm. So those were the kinds of attitudinal objectives that we were working towards. And then more specifically, we wanted them to engage, of course, in particular behaviors. And what we wanted was to see an increase in, and this is a leap that we made through our formative research, we'll talk a little bit more about. We wanted to see an increase in the positive attention and validation that was exchanged between people and among people in romantic relationships and in friendships, again, among our teen girl and teen boy audience. And then we ultimately wanted to see active decision-making related to sexual activity and to family planning, not the sort of default, I'm not going to think about it, this doesn't impact me kind of thinking. But we wanted young girls in particular to be actively engaged in decision making related to ultimately their sexual health and their family planning. So objectives support your overall goal, and you can measure progress through what we call in the public health world short-term outcomes. So that, those might be things that happen within weeks or months or maybe a little bit longer than that. You can also measure your progress towards your goal through process measures, and that is basically what you've been able to achieve in the implementation process. We'll talk a little bit more about that. So we would really love for you all to move from your goal to thinking about what's an objective that would contribute to you achieving your ultimate goal. And again, we'd love it if you would be willing to share some of your thoughts about objectives in the question box. Remember, we'll give you a couple seconds here, but remember that one way or another, objectives should be measurable and they should be achievable through communication strategies. So why don't you all be thinking about what it is you're ultimately working toward, what's the overall purpose or goal of your communication effort, and what's a particular place that you want to get people to be, either in terms of their knowledge, their attitudes, and ultimately their behaviors.
While we're waiting, I'm just going to throw in some example from the real campaign that we worked on. One of the goals that we used as the example earlier was for the community water fluoridation effort for Brockton. The goal was to enact community water fluoridation in the community, and that's basically the policy change. And the objectives that we had, this was the knowledge, attitude and belief and in that the change. The objective we had was to raise awareness of benefits of fluoridation, water fluoridation. A lot of people didn't know what that meant. Why did that we need it for the community? And then the other one is related to the behavior. I mean, somewhat attitude and behavior is not really clear cut. Was to increase support for water fluoridation in Brockton. And in order to make the support measurable, we had tools that can demonstrate. Basically, they have to sign the pledge so that we can keep track of how many support we have. So those are the objective we had.
So those are great examples, and I think a lot of you are also working to build coalitions, further build coalitions, and work toward your coalition goals. Some of you are also working maybe towards a community health improvement plan. And in a case like that, one of the things you might be looking to do is simply to increase awareness. I mean, you have to start, this is sort of a logic model, you have to start with awareness. So people need to know that there's a planning process happening, and ultimately what you're wanting to get out of that planning process. People need to have an understanding of that. You want people to believe, and this is an objective, that participating in the process, that planning process, can more effectively create change in their community. And then Tamaki alluded to this, increasing your participation by giving people something very tangible to do that can be measured is really key. So maybe asking people to formally sign on as a supporting community member or as a supporting organizational partner. There are all kinds of commitments that you can ask people to make that can be measurable. And we're getting a lot of really good thinking here from you all about objectives as well. I see one around awareness. This has got to be a challenge. Building awareness among homeless populations that they have access to Medicaid and that they have a right to Medicaid. That would be a really important and I'm sure challenging awareness objective to achieve. And then moving from there to actually behavior, to getting people to take that step to access the kind of healthcare benefits that they do have a right to. So those are some very, very important and I'd say really good examples of objectives. Measurable things that help you work toward your ultimate, your bigger goal.
And oftentimes for your communication effort, you can have multiple objectives and you can work on all the objective at the same time if you could, but oftentimes you can use phase approach as well.
All right, we do want to give people the opportunity to ask questions. This is just a prompt, but please feel free to be asking questions along the way, and if we can, we'll try and get to some responses. So based on the objectives that you define and in understanding the values, the wants, and the needs of your audience, this is the time to create a promise for them. And this is a promise that you have to be able to deliver on as well. You should be able to name the most important benefit from the audience's point of view that they can experience by engaging in the desired behavior. It should take into account the barriers or in some cases even competition that the audience faces. There's the bottle of water and there's the bottle of soda. There's competition right there for the water, and you can sure believe that the bottle of soda probably has a lot more advertising dollars behind it than the bottle of water. So that's just one sort of simple example. But ultimately, this promise should basically be a realistic response to the question, what's in it for me? And that is something that a very esteemed public health professor of mine sort of pounded into our heads. What's in it for me, also known as WIFM. It's always a great question to come back to, and that really grounds you in your work and whether you are truly helping the audience engage in the behavior that you want them to. You will never accomplish anything if you don't offer the audience something that they want, that they need, or that they value. So using the example, again, of our teen pregnancy prevention effort, this is what we learned through formative research, and therefore the promise that we felt we were able to make. We learned, and we kind of intuitively knew this anyway, that young women in our formative research, they express the desire to be socially accepted, to be romantically desirable, and to get positive attention. These are important things. We weren't going to fight these things. These are valid things that the audience experiences and feels. So our promise to them that that we made through our campaign, and by the way, you don't necessarily use these exact kinds of words, but this guides all your work. For us, the promise was that teenage girls could get attention, acceptance, and validation that they sought without having sex and without necessarily becoming pregnant. And that was the promise that we needed to deliver on throughout the effort. It's important to keep in mind here that you can't fight people's feelings or their lived experience. People are not always rational, and so this point on the right side of the slide is a really important one. Decision making is based in many things, and not too often is it actually based on deep knowledge or clear information. Decisions are made based in things like values and wants and needs. And anyone, young or old, anyone pretty much prefers to experience tangible benefits in the present. They want to be able to have some sense of instant gratification. So that's an important thing for you to keep in mind as you are thinking about your promise and as you are thinking about your overall communication effort.
So engaging the audience, reaching the audience. So this is a big topic that we heard from the registration from all of you. So with that research that you conduct earlier in the stage, and you can always come back to the research, get to know the audience, this is where you can think about how you can deliver your message, and particularly the key promise that Karen talked about. What's in it for me is really important to the audience to get their attention, and also to communicate what you're trying to get them to do. So how can you get their attention? Where they're at, what they're thinking, when is the convenient for them. It's about the timing. It could be about the length of information that you're trying to convey to them. And can the audience try out the behavior when you're actually trying to change the behavior, if it's a part of the goal? You need to make it easy for them to try out. And can the rewards or success be observed or experienced? So for example, if your goal is to recruit more coalition members, as you recruit more coalition members, all the members can observe the growth of the membership. But also it's important to celebrate your success. When we, again, Community Water Foundation, we worked with community champions. We recruited all the opinion leaders and the people who respected in the community. And we had many celebrations along the way. It doesn't have to be like big. Acknowledge the success, acknowledge the growth of the community champion group, or any accomplishment that they've made. So we'll just talk about channels, formats, and content. These are the elements that are very important to engage the audience. Channels could be social media or paid media, could be online or traditional. Word of mouth marketing, that you can go to community events and then talk to a lot of folks in the community. It could be the meetings or letters. Formats could be prints, could be the newsletters, could be e-newsletters, or print, could be flyers or poster, and then you want to think about where they will be distributed. How do you use those prints or collaterals? Even a lot of people think about the promotional collaterals, could be pens or any branded materials, but if you don't think about how they will get distributed or how the message will reach the audience, it's not worth making those.
Mm-hmm. Yeah, absolutely. Tchotchkes, as we may call them, can certainly be useful. They can be useful in promoting awareness, but we really encourage, if you're going to be thinking about those kinds of promotional items, to the extent you can, make them relevant to whatever it is that you're trying to accomplish. For a healthy eating and physical activity campaign that we work on, water bottles, that's good. That conveys the message that you want people to be active, that you want them to be healthy, and you want them to stay hydrated. So to the extent you can, try and be thinking about what kinds of collateral items are actually going to be useful and relevant to the audience. So we're showing you a few visual examples here of a particular campaign. You can see that there at the top left. It's called the Drama-Free Life. this is what ultimately resulted from all of our formative research and planning for our teen pregnancy prevention effort. And this demonstrates to you just a few examples of formats and channels and content as well. So we did have some activity on Twitter. We developed a website that had great content on it because much of it was actually populated by the users themselves. So all of those great sayings that you're seeing there on that front page of the DFL website, that was all content that users themselves posted onto the website. So it was a really, really good example of how we could engage the audience and how they could actually contribute to the overall efforts. And then moving on, related to the same campaign, these are promotional activities that we engaged in. Again, all drama-free life efforts. We worked with a group of young people, youth ambassadors, to help promote our overall efforts. They engaged in some really neat community activities, hosting these like tear-off sheets that were meant to just sort of surprise people with pleasant affirmations and encouraging kinds of quotes on them. There were chalk installations. People chalked the sidewalk to try and build visibility around the campaign. On the bottom left there is a really neat mural actually that we created and was installed in one of the key neighborhoods in one of the communities that we worked in. There were Post-its and ribbons, things that our youth ambassadors could just pleasantly surprise people with, and it was all in the name of driving people to social media and to the website. And I do want to add that this was a communication effort that was part of a much larger federally funded effort that also involved some clinical, educational, and programmatic elements as well. I don't know if you had anything more to add around promotional activities,
Not around the promotional activity, but I was thinking about, so we also have the Youth Tobacco Prevention Movement program 84, and I know that there's some of you folks from 84 chapters participating in this, so thank you so much. So we do actually think about, so the chapters that we work with, they are school groups, high school age, youth groups in the community. We communicate with adult advisors who are always busy and have a lot on their plate. And then trying to reach them, we think about when they're available during the day. Think about if it's the school teachers or school nurses, they are available, they can check the email or talk to them before or after just the school time. We think about the length of information that we give them at a time. We think about the coordination when they are really busy, different quarters or different months or even a day. When we're trying to reach the youth audience, we think about when they actually check their phone right after school. Or even there's a Tuesday, that's when people tend to, based on the data we have, that's when people tend to read the email newsletter or even email better than other days. So we think about those data or think about just the audience in order to reach them. So here, another bite-sized solutions that we are offering.
particularly because we just shared with you some fairly well-resourced kinds of efforts, but we want to acknowledge that there are so many different ways that you can still be going about promoting, your overall communication effort, and we've got some suggestions to share with you.
Social medias, that's very effective now, but we want to kind of strengthen stress the importance of social media. It's not just a one-time thing. It is kind of the getting free puppy. So you get the free thing, but you need to take care of the puppy. You need to feed them. You need to actually spend time and money.
It's not free. That free puppy is not free.
So work with the student intern. They know so much better than even us about social media, how they're used. And use the free tool. Hootsuite, that's a free tool that with that you can schedule all the social media posts. So you don't have to, sit down in front of your computer and do it every single day. You can pre-schedule all the posts as well as coordinate with different channels. Identify a few champions in your community who can spread your message. Again, it's basically volunteers, but so you cannot ask too much, or there's accountability there. But if the champions are the people care about your cause, and don't underestimate their power for the community.
And you can define champions in all different kinds of ways. So they can be informal, they might be, unpaid, or maybe they actually are compensated in some way. The youth ambassadors that we worked with on the teen pregnancy prevention effort, they did receive a stipend for their activities, and they were accountable for engaging in certain kinds of things, and obviously also given the support they needed to be able to do that.
And they're influencers. Work with graduate class or some college of media lab that can offer some pro bono creative media work or any design work at local college. We sometimes work with them to kind of like work on the brand, work on the communication plan, any social media component strategy. So you can look into that as well.
And I alluded to this before, we've got great public health schools here in the Boston area, but and there are great ones around the country, but you don't have to work with public health students necessarily to be able to accomplish some of the things you want. Marketing courses and communication courses can also be really great sources for, they're often looking for a project to take on, for example. So explore what some of your opportunities might be at your local university. All right, we absolutely need to make sure that we talk about evaluation. So you have laid out many of the components of your communication plan, but evaluation planning is actually a key part of the communication planning process. It shouldn't be an afterthought. It's when you consider how you will measure your campaign, it can actually provide you with some guidance. It can get you thinking more deeply about the kinds of channels you're going to use and the activities you're going to engage in. And it also forces you to think about, well, how are we going to measure this? Can we measure this? Do we need to make some adjustments to our expectations because we're going to need to measure something else? So evaluation and the planning of it is valuable because you can demonstrate success or progress in your efforts. And you can also make improvements for maybe a next phase, for example. These are the kinds of questions that you'll want to ask of yourself. What is the purpose? What do you need to get accomplished? How do you want an evaluation to inform you? So we have a couple different kinds of evaluation, and some of you may be very well familiar with these. Evaluative research may measure awareness or recall of a campaign or messages, may measure changes in knowledge and attitudes and behaviors. Those are outcome measures. Measuring outcomes can often require some additional research expertise to be able to do things like, get statistical significance and to demonstrate causation, that what you're actually doing is contributing to the changes that you're seeing in the audience. So if you are looking to do outcome evaluation, we would urge you to consult with researchers when that's possible. the kinds of methods that you might be using here can be pretty in-depth kinds of things. Intercept surveys, that means, sort of talking with people where they're at, just grabbing them, intercepting them where they're at and conducting a very short kind of interaction. There are panel surveys, there are random digit dial surveys. These all generally require some pretty thoughtful study design and sometimes even the engagement of a research company. So it's important for you to ask yourself the question, were the resources that we put into this campaign, was the reach or the exposure of the campaign enough to justify, putting significant resources into evaluation? It's a good question to ask of yourself. But you can measure other kinds of other communication efforts, things like policy change or how effective you've been in your coalition work might be easier, and that is outcomes focused. You can ask yourself questions like, was a policy enacted? Did we get support for a particular kind of policy or regulation? What kinds of outcomes did your coalition or did your collective work actually result in? Then moving on to process measures, these are very, very useful to you, and they can demonstrate to what extent your activities have been carried out in the way that you intended for them to be carried out and whether they were carried out effectively. And here is a good rendition of why process measures can be valuable. Sometimes you think you're on course, everything is looking fine, it's not necessarily looking fine. And sometimes with a little bit of adjustment, you can actually avoid going over the waterfall. You just need to look ahead and make sure that you are taking some process measures along the way. So what do you need to know, and what's going to be useful to you depends on what kind of effort and the scale of your effort as well. They are always quantitative, and it's taken me some years to really respect this, but they are always quantitative. It's how many people you've reached, it's how many materials you distributed, it may be how many people have visited your website, or how many people have engaged with you on social media. And in fact, those are some really good process measures because they're generally getting people to actually do something and demonstrate some sort of commitment. So they don't demonstrate, process measures don't demonstrate that you've met your objectives, but the extent to which you've been able to lay the groundwork that needs to be there in order to achieve your objectives. And they also allow you to make corrections midway or mid-course in your project or your effort and make improvements and learn along the way. So again, we always want to share some bite-sized solutions for you. So here are a couple quick and easy ones. If you do have a web presence in some way, you can use a free tool, Google Analytics, to not only get a sense of how many people are visiting your site, how many hits you've had, but then to actually learn things like, where your users are actually going to on your website. What kinds of content are most important or most valuable to them? Where are they going, and how might you be able to take advantage of that?
And then plus, like, how are they accessing you? Are they always getting information from mobile? Are they always on the go, or are they actually sitting at the desk and then checking your website?
Yeah, there's some pretty amazing things you can actually learn through Google Analytics. And the next is something that we've already talked about. If you can create measurable opportunities for people to demonstrate support or commitment, that's a really, really great way for you to know how much progress you are making towards your ultimate goal.
So the examples could be the tool that I mentioned earlier. Could be the pledge cards. It could be simple card that you create. Go to the community gathering or community events. Talk to them about the benefits of XYZ. Get the support, and they can sign. That's really easy one. And a commitment in terms of recruiting community champions for the task force. We had a commitment card to list, here are the sort of quote-unquote responsibility, what we expect from you. Here are what you can expect from us. And it's a commitment card. It's an agreement card. So those are the small things that you can do.
And now we want to make sure that we take you to this thing that might feel like it's somewhere in the clouds, the communication plan. What does it actually look like? And what we're wanting to demonstrate through this webinar is that you've done a lot of thinking, and now you can turn that thinking into a plan. A couple things that you want to think about are, what is the ultimate purpose of your plan, and what kinds of internal and maybe external needs does your plan serve? These kinds of questions are going to help answer what your communication plan looks like and literally what kind of format it's in. And I want to stress that there is no one solution here. There's no right or wrong. Communication plans should be entirely tailored to your own needs. And I have to say that in our work here, no one client communication plan has looked just like the other. They've all had some different needs, and none of them have been the same. We've always tried to be responsive to whatever it is that our client needs in order to guide them through their communication implementation.
So it's basically what worked for you.
Yes,
the best solution.
Exactly. What works for you? So here are some suggestions. So if your communication plan needs to serve as a point of agreement or a guiding document for stakeholders, for example, then you might want to just create a narrative format for a communication plan. If you've done your homework, if you've done the thinking that we have laid out in the communication planning worksheet, then you have pretty much created your plan already. You've got it largely in place, and in fact, it may be the worksheet. The worksheet itself can serve as an informal communication plan. If your communication plan needs to serve as a point of agreement or a guiding document for, sorry, I already covered that. If your communication plan needs to serve as a visual representation of a communication effort over time, then you might be talking about a Gantt chart. And, this can be a little intimidating for some people, but then some people really like to see things in a calendar kind of format. So this kind of representation can really help you align your communication activities with other kinds of activities and events, particularly if you're integrating a communication effort with programmatic or other kinds of policy or environmental efforts. It might even help you take advantage of things like seasons and what kinds of opportunities might afford themselves with changes of season, or when it's warmer, or when it's colder out, or when school starts, and all of these kinds of things. And it can also help you really understand and visualize maybe a phased approach to your overall effort.
And I think that so this looks a little bit overwhelming, but when folks work on the timeline, everybody look at the calendar to think about, kind of visually think about when it's a good time to do this and then that. And Gantt chart actually do all in one.
And this demonstrates how that coordination can be so valuable. You may very well need to be integrating with other efforts, programmatic, educational, policy efforts, and so on. So that kind of coordination is really going to help you get to the place that you ultimately want to get to. And finally, if your communication plan needs to maybe keep people on task, particularly related to objectives, making sure people are always going back to ensuring that their activities are on task, they are on objective, they are on message, that kind of thing. If you need people to stay on task related to particular activities, to make sure that you are collecting process measures, those kinds of things, then something like a spreadsheet or a table might work for you. And this can look however you want it to look. You can have whatever rows and columns you need to communicate internally and coordinate internally and make sure that that you are getting what you need out of your communication plan.
And we realize that some of you might have already been doing this, using the spreadsheets, very accessible. But here, we want you to make sure that the key elements are a part of the spreadsheet.
All right, and then what we want to do is take you through, we've been sort of giving you examples, little glimpses into some of our work, some of our campaigns and other communication efforts, but we want to walk you through one particular one that I think can really take you again through all the steps of the communication plan right on through evaluation.
Okay, so this is the campaign for Brockton. The goal was to enact community water fluoridation, basically bringing a fluoride to Brockton's public water supply. And we are fortunate enough to have some resources to be able to do this campaign. But I'll talk about this project in the way that's more applicable to you. So we've talked about the primary audience and the secondary audience here. So the secondary audience are the influencers to the policymakers. Mainly, we worked with community champions and to reach those other key audiences in the community. And so we had a recruitment for all these community champions. We worked with local coalitions, Greater Brockton Health Alliance. We've used, so this was one of their the priority initiatives. And we've done focus groups, coming back to this, we've done focus groups, key informant interviews to get sort of the insight of what's happening in the community. We didn't specifically ask about the fluoridation or Aura House. We wanted to get an insight of what's in their mind, what's important to them, what they like about the community, because this is all about the community. This is not individual behavioral change. So we talked to them and asked them about what keeps them up at night, what do they worry about, what they like about the community, what's the great asset for the community, and what they think about the community, how they define the community. So what we found out was this is throughout the community, just the theme. Just realizing that the policymakers, a lot of them are also parents, a lot of them kind of like overlap the different audience groups. We learned that there are a lot of sort of like micro communities within the communities. And each micro community, they have such a pride in Brockton. And that's a really big theme. And we kind of wanted to use that sort of the pride and approach as part of this effort. And that's where the One Smile Brockton name came from. Everybody's working toward the same goal, and this is for the One Smile Brockton. Everybody's great oral health status and great smiles, and then overall health as well. We've talked with key informants, some stakeholders, and we learned that, well, we also did some environmental scan. And in order to work with policymakers for the policy change, we learned that you have to work on both grass top and grassroots. So hence, we needed to get support from the community. And the Brockton is the biggest Cape Verdean community outside of the Cape Verde. So we wanted to pay attention to the community. So we had Portuguese materials and Haitian Creole materials as well. We went to the churches where the folks are at. We went to the main street. That's where they hang out. There's apparently there are some stores and really important places for the certain communities. We also, oh, here's another great one. In terms of messaging, sometimes based on the formative research, you want to kind of use what's important to them, what's in it for them, what they're thinking about. But be clear about your cause the issues that we're trying to work on. And it again depends on the approach you have. The social marketing approach doesn't necessarily tell what the cause upfront, but for this particular case, we use invest in Brockton's future. The future investment was the big thing for the Brockton, but they didn't really see the fluoride, fluoridation piece in it. And some folks thought that we are promoting dentist office or some dentist. So we kind of like missed opportunities at the beginning. So here's another kind of course of
mid-course adjustment
yeah. To make sure that we changed the message to, did you know that the Brockton is not fluoridated? So that's the big fact that just came up, while talking to a lot of folks in the community. They thought that the Brockton was already fluoridated, but it's not. So we kind of changed that message. We also used the pledge card that I mentioned earlier. That so this could be really tooled, measurable. Have them sign that we support One Smile Brockton. Let's bring fluoride to Brockton. We collected them. We took a picture, just a photo pledge. This is a great thing to do. You can use them and post them on the website. We talked to engage other stakeholders and local organizations. We got a letter of support from the organization. We posted the letters on the website. Great way to show the support to the community as well as policymakers. We had a banner. A lot of people at the event, they signed. This is part of the support as well. Went to a lot of different community events and the meetings. I know I kind of rushed through this case study, but folks, if you have any other questions, want to learn about this, feel free to let us know.
So we don't have time for many questions, but one has come up. And Charlene, I hope you still are on the line so that we can answer your question here, although it's not necessarily an easy one. So Charlene asked, basically, what if you need a communication plan that does everything that you just talked about? And it's a fair question. And actually her follow-up was, well, do you have like multiple formats or different versions of a communication plan? And this actually did come up very recently with a client. I mean, first of all, you can make this look whatever you want it to look like. If you can somehow make this like three-dimensional, that's awesome. But in the absence of that, we needed to sort of work with a client to get them on board with our overall vision in terms of what we recommended for a communication plan. So it was presented as a very narrative form. And then using that as a point of agreement, we then actually created that Gantt chart. I sort of made it a little more generic for the purposes of the webinar. But they needed and we needed to see what this might look like in terms of really rolling out the effort and what that was going to take in terms of time and when we could expect to hit certain milestones. So that was a little bit more a matter of making sure we had a very clear narrative approach to a communication plan, and then something that looked almost more like a work plan that really laid out when things were going to happen, what the milestones and tasks were. So I hope that helps you a little bit think about where you might be able to take a communication plan in terms of your own needs.
Thank you all. And if you have any more questions, of course, we have their contact info here. I want to thank Karen and Tamaki for a wonderful and insightful presentation on communication tips. That is it for us. There's in-person training coming up later this month. You're welcome to go to our website for more information. We will follow up with more info, and please do not forget to fill out the survey from today's webinar. Thank you to the Massachusetts Department of Public Health for funding this webinar, and thank you to our wonderful presenters for this great webinar today. And here goes our contact info. Have a great afternoon, y'all. Thank you.